Deserae, you are one of those great physicians here at the Gateway Medical at the Specialty Hospital. You are great because she's my doctor. So it's nice to have you here.
Well, thank you.
Tell me a little bit about your practice and, in fact, about the Gateway Medical and the Specialty Hospital.
Well, I'm one of the physicians at Gateway. We have 5. We have 2 family practice. We have an internist, a neurologist, and I practice as a family practice physician.
And you know, you take such good care of the community here with the Specialty Hospital being relatively new. I mean, it's been around for quite some time, and Gateway Medical offers so many different, like you just mentioned, 5 different services. Yes. Let's talk specifically about yours, Deserae. You are primary care. Tell me a little bit about who you cover, who you help, and that kind of thing.
Well, I am a rural physician, so we pretty much cover everything. We cover women, men, children, and we pretty much take a look at their overall health and preventative health to start with. Now, I come from a small town in Idaho where I grew up with family practice and with rural physicians, and one of the things that attracted me to the area of primary care was that every person that comes in has a story, and I kind of fall in love with the story that they tell. And it might be that you have a single mother who has 5 children at home and she's neglecting her care. But unless she takes care of herself, you know, it's difficult for her to take care of her children. So we want to bring her in. We want to draw her blood. We want to make sure there's no thyroid problems. We want to make sure she's eating well. We want to make sure that she's got support systems and that she's balanced. We might have, for instance, an elderly couple where one is taking care of the other. Again, usually one of those, you know, he's taking such good care of her or vice versa that he's neglecting his care. So, and then we want them to bring their children in for their immunizations and their child checks. So every one of them has a story that's very compelling, and so we bring them in and we start from the beginning. We get that story, we find out what they need, and depending on the age group, it helps us decide what preventative care they need. So if we're talking about women, so if we have women who need preventative care, then we're thinking of mammograms, we're thinking of PAPs, we're thinking of, and also in our adolescents, we're thinking of whether they're in their reproductive years or if they're in their menopausal years. So we're thinking about all of those areas for them to look at.
You know, I love that. I've never heard a physician talk to me about the story. It's always about the ailment or whatever, but you're looking at us as real people, which is so great. And then also, I think that I did this, looked at you as the woman's doctor. So to know that you will help with the children and the men out there, and then they have their own stories and probably are screening for different kinds of cancers, like you mentioned, the mammogram and things like that, pap smears. But there's the colonoscopy and all of that that's really across the board.
And things are age specific. When you talk about colonoscopy, both in men and women, we're talking about age 50. If there's a family member, like a first degree family member that has that, then it'll start earlier. We also talk about prostate exams. They'll start for men at 40. And there's a period of time that is lost for both men and women. It's kind of in their 20s where they don't get seen quite as much, and they really do need follow-up care. They need to know, they need advice on certain things that they come in contact with and are experiencing.
You are so right. Kids get off to college, they're away from their parents saying, why don't you get to the doctor? So that's fantastic. So if you are a young student or you're maybe that parent of the child, give Deserae a call. You offer just such a wide variety there that you can help us all.
You bet. We do just about everything. But if we need something, if we need an endocrinologist, if we need a rheumatologist, we'll reach out for that. But most of us have pretty much seen everything.
Well, it sounds like you can cover it all and take care of us all. Let's talk about the Gateway Medical is in the specialty hospital?
It is. And that's one of the things that we wanted to stress, because it's not like you can just drive by it, though we are going to put a sign out there. It's inside in Suite A, and you just go in the front doors, and we are located just to your right. And we have many specialties in there, and we just happen to be one of them.
And you are accepting new patients. It's one of those other things that you think about. She's the woman doctor and she's already booked, but you actually really make time for other and new patients.
Yes, we keep some slots open when people are very sick. If we need to add patients, sometimes PAPs and things like that are scheduled a little further out. But we also take call for, a week, and we bring people in through the emergency room, admit them to our hospital, and can completely take care of them there.
And you do take care of us all. That was what you did for me, one of those quick get-me-ins and help me out in an emergency. So thanks so much, Deserae, for the interview and for the service.
Thank you.